Hi, and this is my project, the Mind Diet for Patients with Alzheimer's Disease. So what is Alzheimer's disease? Alzheimer's disease is a disease that affects the brain, which causes dementia and cognitive decline in the elderly. Alzheimer's disease accounts for 60 to 80% of dementia cases. And in Alzheimer's disease, there are big changes that are happening in the brain, such as abnormal proteins form amyloid plaque, which builds up in the brain, which causes the healthy neurons to stop functioning properly. And these neurons then lose connections with other neurons and will start to die. As you can see in the picture above, there's a healthy brain on the left and a brain of a patient who has Alzheimer's, and you can see the brain is much smaller due to the lack of neurons. And why does this matter? Well, current thoughts on AD is that it has a genetic component that becomes more pronounced with age, and Alzheimer's disease ranks 5th in leading causes of death for adults aged 65 and older in the US. And these numbers are expected to rise as the population is aging, and we have a lot of baby boomers in the country as well. So here are some of the stages of Alzheimer's disease. For the first stage, a normal adult, you have no functional decline. Second stage is awareness of some functional decline. You start to notice that you're forgetting things. The third stage is early Alzheimer's, functions usually at about 12 years of age, so not remembering to do certain things, forgetting to feed yourself, and other things like that. The fourth stage is mild Alzheimer's and requires assistance of a caretaker or a personal assistant. Fifth stage would be help getting dressed, and only functions at a 5 to 7 year of age level. The sixth stage is 100% 24/7 care, and at this point in the game, their brain is no longer functioning at the level that it should be. And the seventh stage is severe functions at a level of a newborn, just because the brain is getting so much smaller because of the lack of the proteins. And this is a scale that's known as the FAST scale, which was developed in New York University Medical Center, Aging and Dementia Research. This is a good way to explain to somebody what stage they're at and help caregivers understand what is going on with their loved one. So, what can we do to prevent some of the symptoms or delay the progress of Alzheimer's disease? And that would be, one of the ways you could do that is through diet. Now, this diet, known as the MIND diet, which is short for Mediterranean Intervention for Neurodegenerative Delay, is an approach to eating healthy, emphasizing 10 brain healthy foods included in both the DASH diet and the Mediterranean diet. And those foods include leafy green vegetables, nuts, berries, beans, whole grains, fish, poultry, olive oil, and sometimes wine. But let's go easy on the wine and beans. It also is really simple. It's easy to follow, something that, a normal person would like to eat. Just stay away from the red meat and the sugary drinks and processed foods. A lot of studies have shown that, more blueberries and strawberries, it's really the berries that matter the most because they have the most antioxidants and rich to help with the brain functionality, as well as fish, but I'll get into that a little bit later. And research, like I said, has shown that subjects who follow this diet tend to decrease their risk in developing Alzheimer's disease, and also can, delay the progress of the disease as well. And for the literature review, there's a lot of research out there on diet and how it prevents Alzheimer's disease and how it can slow the progress down. One of the studies found Martha Claire Morris was actually the first person to develop the MIND diet. It just took place in Chicago, where 923 residents between the ages of 58 and 98 who were part of the Rush Memory and Aging Project, which was an ongoing study that aimed to identify factors that protect cognitive health. Their research found that this diet actually lowered the risk of Alzheimer's disease and delayed the progress of symptoms of the disease. Also, from Riviere, they found that weight loss is a common problem in patients with Alzheimer's disease, and they just really simply forget to feed themselves. And the objective is to see if a nutritional educational program could prevent weight loss for patients with AD, and the study found that implementing the program had a positive effect on the patient's weight and cognitive function. Like I said before, fish is actually a really important part of the diet, the MIND diet, and Pascal Gattu found that if you eat the fish at least once a week, you actually lowered your risk of developing dementia. And it's found that the fatty acids that are in fish oil actually reduce the inflammation of the brain and regeneration of the nerve cells. Also, by Scarmies, there were 2,258 non-dementia individuals in New York, and they were evaluated every 1.5 years to follow up, and after a 4-year mark of following up, the individuals there were only 262 Alzheimer's disease cases, and this also showed that a higher adherence to the Mediterranean diet proved to help individuals lower their risk for the Alzheimer's disease. Now, for my research hypothesis, I suggest that Alzheimer's patients on the MIND diet progress slower than patients not on the MIND diet, and then my null hypothesis is that Alzheimer's patients on the MIND diet progress at the same rate as Alzheimer's patients who are not on the MIND diet. For my methodology, I'm going to be using the Dementia Severity Rating Scale, which is also known as the DSRS, and it's an informed-based multiple-choice questionnaire that scores range of the disease from mild, moderate to severe. And in this case, my patients will be using the mild, which is on a scale from 0 to 18. Also, why are these tests being, or when are the tests going to be done? The tests and research should be taken this morning to avoid the sundown effect, which happens in Alzheimer's patients. And patients, just their confusion may worsen later in the day opposed to morning hours. So it is best to do the same time every day so there's no confusion. The data that will be collected for a year, once a week on the same day and time, like I said, to avoid confusion. And the data that will be collected will be a basic blood test, weight, height, and a DSRS questionnaire. The test that I will be using to measure the data will be a t-test, be used to measure the data as independent and true groups are being tested. So when comparing the difference between means, you have two groups and independent samples, and that way you would have to do a 2-sample t-test. And for the discussion and conclusion, some of the safety and precautions to look out for when doing the study is making sure all the information is secure to maintain confidentiality, to know other underlying medical issues that the patients may have and that can affect the results. Any risk of any patient dropping out for the study is a reason or a precaution. Making sure the patients are aware of their participation. Just because of their memory loss, you constantly have to be reminding them. And there is no real risk of harm in this study just because we are simply asking them to change their diet. And there may be confusion from patients, just remind them of what they are participating in and they have consented 100% to the study. And the goal for the study is to see if the experimental group progresses less than the control group. And if the study were to yield positive results, it will be a step towards not using drugs to treat Alzheimer's disease. And with more research, with a non-medical intervention for Alzheimer's disease will help further research and help the community of people who have Alzheimer's disease. And there are my references, and thanks for listening, and thanks guys.